our second case report. So here we have a patient with regular cycles, but she's concerned about some low hormone levels. So she's a 28 female. She's switching from trying to avoid to try to conceive. She's had one pregnancy with a live birth, December of 2021. And she reports that she feels her weight is much heavier than before. Her situation is she's currently breastfeeding her toddler, her 2 year old. Her cycles have returned. She's had about 10 cycles since being postpartum. But she's noticed two things. She's had some bleeding with her mucus around peak day. And she's concerned about the last two cycles, low estrogen levels. So she's been testing for quite some time. So here is her previous cycle. So back October of 2023. And if we look at this data, we can see overall a coordinated, balanced estrogen rise leading up to that LH surge. The LH surge is on cycle day 16, followed by a change in her progesterone confirming ovulation. So overall, this pattern looks good. I can see evidence of ovulation. But if we look at the cycle that she was concerned about, so this is where she had reported a change. So now here we see overall low hormones. This is June of 2024. So the mirror data discovered minimal E3G changes prior to the LH surge. She had an LH surge on cycle day 15, and now we see minimal progesterone changes after the LH surge. So overall, this could lead us to be concerned about a suboptimal ovulation. So Dr. Stefani, is having a regular cycle enough, or seeing this information, having this background information, how is it helpful to you?
I think it's really helpful. I love looking at a pattern over time and then lining that up
Mm.
with a patient's experience of what they've been going through in that time. And oftentimes for postpartum moms, there's a big difference in what they're experiencing at 6 months or a year or 2 years postpartum, especially if she's nursing that whole time. And so the 9 months difference between those charts, you see that what I interpret from this is she's gotten more depleted. It
Mm.
takes a lot of energy to continue nursing from a nutritional perspective. And in this case, when I'm seeing the hormones being lower, I'm wondering if she literally has all the ingredients to make those hormones. It takes a lot of cholesterol, a lot of healthy fatty acids, and that the body prioritizes putting that into the breast
Mm.
milk and rather than leaving enough for her hormonal balance. And also there's a need for coordination with the thyroid and with iron levels. And it's not uncommon for individuals who've gone through a pregnancy and then a delivery and then nursing for a while to be nutritionally deficient, also be a little hormonally deficient, and they're probably not getting enough sleep to trigger a good hormonal balance. So this is helpful and empowering for me to advise the patient to take a little bit of time and see if we can replenish her body before she goes into that next pregnancy for the health of that pregnancy, and so she doesn't get more depleted and be more symptomatic during that time. And it'll also empower her to decide if she should wean before she tries for that next pregnancy, because she's ovulating. This is a suboptimal ovulation. Some people aren't able to stay nursing and conceive, others can, but having this data to see how she's improving with your nutritional and hormonal balancing support to help her make that decision would be really great.
Yeah, I think just being able to have that conversation with the patient with data in front of you to, it might help the patient to realize what she wants to do, or what she doesn't want to do yet. And so more of a candid conversation with your patient, I would expect to be able to happen.
Yeah, for sure. The
Okay,
secondary infertility is really scary. And if instead she's actively choosing to not yet try because her body's not in a place that it could conceive, that's a really different experience than more passively going many months and trying and not knowing why you're not conceiving from that mental emotional perspective is really different.
yeah, that makes sense.